I'm Eric Billings. I live in Lewistown. I was diagnosed with HIV/AIDS in 1990. At that time, my doctor gave me 6 months to live, 6 to 18 months, they said. And in the early 90s, we didn't have any medications for HIV/AIDS except for AZT. I took AZT 4 times a day. Well, I had to take it every 4 hours, 4 pills a day. And by the grace of God, I made it to 1996 when they came out with protease inhibitors. Since then, I've been on the protease inhibitors. But while you're on those protease inhibitors, at first it was only, you have to take 6 pills. But then I'm suddenly having all these side effects. So I'm getting peripheral neuropathy, which is tingling of the hands and feet. So they had to give me another prescription for gabapentin, which is a prescription that costs, at the time over $1,000 a month. It was a new prescription. I couldn't hold anything down. I couldn't eat. I was getting sick all the time. A lot of these medications AIDS patient takes is like doing chemotherapy on a daily basis. But good old Eric, conservative Republican that he is, I had several businesses, 40 employees. I didn't want anyone even knowing that I was around pot or near it or anything like that, because it was always taught to me it wasn't medicine. I didn't understand. I grew up in that age where the rest of you grew up, where we were all taught that it's an evil substance. My doctor in '96 finally told me, he said, you're going to have to start at least smoking marijuana to help your appetite. The Marinol alone isn't doing it. I was paying $1,000 a month for that. It was $950 or $1,000 a month just for that one prescription. It just psyched me out, making me sick all the time, wouldn't work. So from that point on, I started smoking marijuana. Thank God that we had this law come into effect a few years ago. I was patient number 7. Through those intervening years, I had to live like a criminal. I had to buy my medicine off the streets. I had the whole 9 yards, It's a scary thing. It's a scary thing. If you've never been a person forced into that kind of lifestyle, I grew up in a good Catholic family. We went to church all the time. Mom went to church every day. All this was totally against me. Everything I stood for. The marijuana, though, it solved all those medical issues I was having. Pills a day. I'm able to work again. I work 5 days a week. Like I said, 12 pills a day. I take nothing for pain, which was one of my major things before. I know probably a lot of you have had clients who get addicted to pain medications. And if something like this was made more available to pain patients, they wouldn't have to go and get hooked on OxyContin and Vicodin and stuff like that. I've never known a person who's hooked on marijuana. I've never known a person who takes marijuana, at least for any kind of medicinal purpose, whether it be a headache, a cut, HIV/AIDS, Kiera is another one I found out about today. It's a medicine, and the more people that we're able to educate about this, the better. Marinol, the one prescription that doctors do give, is supposed to be the active ingredient. It's got THC in it, which is the active ingredient in marijuana. The little tiny pills. The problem is there's 64 cannabinoids in a marijuana plant. You need all 64 of those cannabinoids because they work differently on every single person. Marinol only has 2 cannabinoids in it. That in the 1960s or something like that, I think Bob probably know more later, when they did the research, they found that these 2 cannabinoids made some people hungry. So that's why it became, Marinol, and why we're stuck with a lousy medicine that's no good. Everybody I've ever known who's been on Marinol gets sick off it, has to go on antidepressants, the whole 9 yards. And it doesn't work. I was 88 pounds when I started smoking. I was down to 88 pounds. And it's different today. I'm alive because of the voters of Montana taking an interest in the cause. And now it's time to protect people like myself and other sick people in this state. And that's why we're here today, to help you with any kind of tools that we can give you to carry effective defenses forward. So we'll be available afterwards if you want to ask any questions. Thank you.